Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Half a day. If you're just tuning in, we are discussing back to school health care for our children. Joining me now is Dr. Jitka Lom from ExpressCare, who will take your questions. First question our viewers have is, I know that certain juice box drinks contain a lot of sugar. Are there ingredients I should look out for when buying drinks for their lunch?
The best drink that you can give your children is water. If you can get a metal recyclable container or even a plastic recyclable container, that is the best thing you can give your kids with some ice in it, and they'll be rehydrated and ready to go without adding a whole bunch of extra sugar. So if you want to give them a treat once in a while, you can give them juice. Choose one that does not have any additional colors or additional artificial flavors, because those do interfere sometimes with children's ability to concentrate. Depends on the kid, but many of our children have obesity issues and also have a lot of dental caries, cavities, and it'll serve them better if you stay away from the sugars. There are a lot of names for sugar in juices. Even the juices that have no added sugar are full of sugar, because they have, for example, high fructose corn syrup, they have fructose in them, they have other sweeteners that are not in any way beneficial to us. So a simple juice that usually works well is apple juice. You can dilute it, and that's a nice treat. Again, you could package it in your recyclable container. Try to stay away from the juice drinks that are, for example, Capri Sun or the Sunny, or those type of drinks that are extremely sweet and not very healthy.
All right. Our second viewer is asking, when school begins, how much exercise should my child be getting daily to ensure weight control?
For weight control, yeah, it's extremely important that our children get exercise, and national guidelines say that every child should get at least 1 hour of exercise per day, every day. That is the national guideline for children of healthy weight. If your child is actually overweight, your child may need even more exercise than that. So please try to put them into their after-school activities, sports, baseball, soccer, swimming. If you can't do that, have them ride a bike around or kick a ball or something that does not involve electronics and sitting, which tends to be the most popular activity for some of our kids. So knowing that you can ask your doctor when you go for their physical, or even check it online to find out what your child's ideal body weight is for their height. You can find out online, and then try to get them to get close to that at least.
Okay. Now, the next viewer is asking, my teenager likes to drink coffee in the morning before school. Is this safe?
It is safe, especially when it's a teenager. There's different kinds of coffee, right? There's the Mr. Brown very super sweet coffee and so on. But if your child is just having a regular cup of brewed coffee, 1 cup in the morning, that is fine. And it may actually improve their concentration. And many European countries, that's a normal thing that people do that in the morning. What you want to get away from is the sugary coffees, the giant coffees, the extra, shots or whatever of caffeine, but 1 cup of coffee may be very helpful in helping your teenager brighten up in the morning and concentrate better.
Is there an age recommendation?
I think over age 12.
Over age 12?
Yeah.
All right. Now our next viewer is asking, my child is starting middle school and is very nervous. Is there anything to help curb his anxiety?
Lots of exercise is very helpful for anxiety for children, and making sure they get enough sleep. Then talking it over with them, finding out what are their true fears. Are they switching schools and nervous about making friends? Are there certain people that they're afraid of meeting up with? Are there classmates that are bullies there? Is there a teacher that they've heard bad things about? Encouraging them to verbalize, maybe even write down some of their fears, or draw a picture of what it is that they're really nervous about, helping them explore that and helping them to have coping skills. So in advance, okay, well, when this happens at school, what are you going to do? What are some strategies that you can have to cope with the situations that may come up? And that way, your child will feel prepared. They'll know that if there's some situation that comes up, I have a plan for that.
Okay. And our last viewer is asking, can my child's mood swings be attributed to diet or lack of sleep?
Both diet, lack of sleep, and also the situation in the home and at school. All of these things can affect our child's moods. And children are sensitive people. They have moods and feelings just as adults do. And sometimes they're very deep and can be, it's unfortunate when we discount them. So as far as diet, yeah, a healthy nutrition. Please give your child a vitamin every day in case they aren't eating enough fruits and vegetables. That'll help. Make sure that they're drinking lots of water, eating their 5 fruits and vegetables every day, and avoiding processed foods. As far as sleep, we talked briefly, just making sure that your child is turning off their screens at least an hour before bedtime. Rule of thumb, let's give it 8 p.m. for the elementary school people for bedtime, middle schoolers 9 p.m., teenagers, let's try to get them in bed by 10, at least hoping that they'll be able to get a good night's rest.
All right, Doc. Now, you mentioned earlier a little bit about bullying. Can you just share with us some very quick signs that we can look out for?
Yeah, each child will react differently to bullying. Some will be angry, some will withdraw, some will be very anxious and stressed out. Some may have physical symptoms of headaches and vomiting and actually breaking out in rashes. These are all possibilities for your child. So pretty much it's sometimes really hard to tell without really talking to your child and finding out what's happening during the day, maybe talking to their teacher. Some of them are also bullies. So if you have a suspicion that your child is an actual bully, you may also want to talk to them about how they're treating others and how they might have a more successful and happier experience at school if they treat others the way they want to be treated.
All right, thank you so much, Doc, for
You're so welcome.
your very wide range of health knowledge.
Thank you.
Now, if you would like to learn more about back-to-school health tips, you can always visit ExpressCare's website or their Facebook page for their 20 top back-to-school tips. And make sure to join us next week as we will be discussing facial hair. Also, if our viewers want to know more about special promotions and services, once again, you can find ExpressCare on Facebook and make sure to sign up for the informative newsletter. We'll be back to wrap up the show when Healthy Living returns.